If you have a strong family history for high blood pressure, you probably have this genetic predisposition. But remember, the genetic predisposition by itself is not enough to cause you to develop high blood pressure. It requires these adverse lifestyle factors. So in the modern world, many of us weigh too much. We eat too much sodium. We don't eat enough potassium, so our diets are not good. We don't exercise. We're under stress. We don't sleep well. And it's all of those kind of lifestyle factors interacting with that genetic predisposition that results in the development of hypertension. For example, if we look at unacculturated societies, these are tribal communities that live a very primitive lifestyle. Those individuals, many of them carry the same genetic predisposition that those of us who live in the modern environments do. But in those societies, there is no hypertension. It's rare. And there also is no tendency for the blood pressure to rise with age. The differences between them and us is that they are very active physically. They eat a very different diet that's usually rich in fresh fruits, vegetables, no processed food. It's very low in sodium, very high in potassium. Obesity is almost unheard of. And so without those adverse lifestyles, most of them don't develop hypertension. However, if a group of them move into the cities and start to take on the modern lifestyle with its diet and exercise habits and the like, they begin developing hypertension just like we do in this country. And it's more than just telling people to stay away from salt, eat more potassium, exercise more, lose weight. You really need to be guided along the path to actually be able to do those things in your daily life. If there are identifiable adverse lifestyles that can be corrected, and they do so, they can lower their blood pressure and control it just by doing that. About 75% of people, and those with more severe hypertension, require a combination of adopting those healthy lifestyles and also taking blood pressure medications. But the good news is we have a lot of medications available to treat hypertension. They do work. Most of them are very well tolerated. And with a combination of lifestyle and drugs, we can control blood pressure. And the good news is we know from studies that if we control blood pressure, we dramatically reduce the risk of the adverse consequences from its presence.